This is Gary Atensa with CNTV, and today we're in Longmont, Colorado. I'm here at Alternative Family Medicine and Chiropractic. Since 2010, they've been providing comprehensive chiropractic care and basically alternative medicine for folks here, not only in Longmont, but the surrounding areas as well as Denver. I'm here with the two doctors of chiropractic. Ladies, thanks so much for joining us here today. Let's start off a little bit about yourself, Ann. Basically, you were a graduate of Western States. You basically went on a lot of advanced training that you've got throughout the years. Share with me how it is you got involved in this type of industry.
Well, actually, chiropractic changed my life personally. So when I initially did negotiations for Lockheed Martin, which was a great job, it was pretty amazing, but my passion laid elsewhere. I really liked health, and it was just my own healing struggle and journey that actually got me here and got me passionate and started this practice, was really my own struggles.
So this is definitely a personal journey that began for you. Let me ask you, what about yourself? I mean, is this something that you grew up with, or basically does it run in the family? Explain.
Yeah, so my grandpa and my father are both chiropractors, and my uncle is a doctor of Oriental medicine. So I grew up around it, and it's pretty much, I can't live without it.
Excellent. Let me ask you, this holistic approach to health that we have now, why do you think that it's necessary for our society today, even more than it was maybe 20, 30 years ago?
Well, I think most everything, we're either diseased or not. So how the medical community seems to look at everything is they're treating disease because there's so much disease, and there's no fault in that because there's so much that they need to do. But a lot of people are falling into more of a gray zone. And so they've got bloating or discomfort or things that just sort of fall into the ominous categories. And so that's where alternative medicine and functional medicine can really, really help, where you analyze the blood work and you're using just smaller ranges to really pick up where the nutritional deficiencies are and fix the organ systems that need to be fixed before they get into that disease pathology where you're actually having to really use big guns for it.
I mean, these two areas that you've really specialized in, they're both kind of a lifeline for our body. We're talking about the spine, which carries the nerves to the rest of our body, but you're also talking about blood. Do you find that the two of them kind of work hand in hand together?
Absolutely, yes. I mean, the big thing is when you're treating the biochemical, when you're treating with nutrition and things like that, and doing an individualized approach to what someone's blood work is showing and what they need in nutritional deficiencies, and then fixing the corrections in the spine and actually doing the muscle work and the scar tissue and the dry needling to actually restore the muscle function, people's spines move. So if you think about someone's posture, if they're sitting like this, what do you think is happening to their internal organ systems? They can't move. Your digestion doesn't function. So that's why it's really important to correct the spine, but to correct the spine, to correct the digestive function, but also give them the nutrition that they need in order for that to function correctly, right?
Excellent. Let me ask you, when viewers out there, when they think of chiropractic care, a lot of them are thinking of car accident, a bad back, something that maybe might have happened. Yet, when you ask them about preventative care with chiropractic, they don't seem to understand it as well. Is this an ongoing education that you provide for folks?
We lift, we're moving all over the place, and you're constantly just getting a little bit torqued up. And so if you're not kind of dealing with that, everything just tightens up, and over time you develop things like scar tissue, and you get into these compensatory patterns that may not affect you right here and right now, but 20, 30 years down the road, you might be wearing down a joint improperly, kind of thing.
So explain to the viewers what can happen on a daily basis in regular life. I mean, no car accident needed. That basically can cause the nerves damage, the spine damage. Explain that to us.
All right, so just think about when you're sitting at a desk all day. What's your posture? You're perfectly sitting at a desk. Most people have desk jobs. So when you're sitting like this with this rolled forward posture, these pecs shorten, and then this is going to, you're going to have a lot of problems back here, right? Everybody, oh, this really hurts, this is really sore. And that's because there's muscle imbalances going on in your body. And you think about what that's going to do over time. You get degeneration, you get scar tissue. And so all those areas actually need to be cleaned out, fixed so that the nerves and the blood flow and everything else can function properly in your body. People say, well, I don't hurt. I don't have any pain, so why do I need treatment? Well, I mean, your car's not smoking. I mean, well, or your one tire isn't completely flat. Why do you need to fix the tire then? Or why do you need to fix the alignment of the car? It's like anything else, you absolutely need maintenance care. Just like Dr. Jennifer Christian said before, we bend, we lift, we twist, we carry things, and that creates all that micro trauma all the time.
What is strangely enough is the fact that people think of my back hurts and, chiropractic, yet we're talking about something. I might have a problem with my liver, kidney, even tingling in my hands. These are all things that chiropractic can help. Does that surprise a lot of folks when they realize that the body is so complicated and it's all tied together?
Oh, definitely. I mean, a lot of people come in and they don't even realize that we work on the extremities or the arms and the legs. They're just completely blown away for it. So, yeah.
Well, one of the things that basically you come really from an occupation before, kind of a science-based, Lockheed Martin. When you began this journey for yourself, were you a skeptic yourself? Was there a lot of research and study on the front end?
So when I initially, let me just tell you my health story because I think that'll make things a little bit more clear. But I remember going to the doctor and I had all this acne and I had all these menstrual cramps and all kinds of other problems, and I was actually getting hives, and everybody just kept on telling me that I was normal. And suddenly when I had to get my appendix removed from my body, I thought that maybe there was something else potentially going on or that was maybe wrong that wasn't being addressed. But again, I fell into that gray area. And the first person, the only person that could really treat me was in alternative medicine. And that changed my life. I didn't have the problems that I was having before. In fact, that when my appendix was about to rupture, I thought I was just having menstrual cramps. And you can't think that that's normal. That's so bad and people feel like that and go through their life like that all the time. So I think that just the results made me a believer. I mean, not the research and not the studies, and those are great, and I think that some people need that, but just the dramatic change in my lifestyle and what I looked like and everything else was huge. I mean, it made me a believer.
Like you said initially, it's a life changer for you. Much study, much research, that first adjustment, you quickly realize that not only your back can be adjusted, but parts of your arms, your legs, your feet, you name it. Share with us there.
Absolutely. I mean, one of the biggest problems for me was I had flat feet. And a lot of Americans actually do have flat feet. Or you've heard the term overpronation, or they roll in, or they just ache. Well, I was a dancer and a runner, so that was huge. Like, I was on my feet all the time, and it created back issues and everything else up my spine that was really uncomfortable. But fixing my feet made a huge difference in my overall health.
You were a graduate from a 4-year doctorate program, basically from a college that very evidence-based medicine. Is that something that still really drives you every day?
I think that it's really helped in practice because some people really want to see the evidence and they want to know why it works and where the studies are, and I think that that's really important. And some people are more, well, I just want to feel better, I want the results. And, I think it's really good to be able to speak to both audiences, and it's good that we have both things. We have the passion and we have the results, but we also have the evidence that we can show people.
When you really went through this transformation of a new you, one of those key factors was also nutrition. Is this something that you also incorporate into your daily work here?
Yes. I mean, again, functional blood chemistry is huge in our practice, which means that we take someone's lab work. We either run lab work in our practice or we go ahead and take the lab work that they get from their MD, and we look at it, and basically we create this individualized protocol for each individual patient to be like, well, your liver enzymes are here. So lab work, again, is a standard deviation of the population, which means you're compared to me, and we're compared to the fella up the street that hasn't moved off his couch in 10 years, and then we're compared to the super athlete down in Boulder. And they take all of us together and they say, this is average. And every time you look at the reference ranges, you think, I'm normal or healthy. You're just average, unfortunately. You don't have the disease processes. So we're able to use more finely delineated reference ranges, and then also compare them with people's symptoms that they put on our symptom survey, and we put together a specialized treatment protocol, and then we can track the numbers on how their liver enzymes are improving, or how their blood sugar is doing, or what's going on with their thyroid markers. It's amazing to see that. So.
We're talking, I mean, we've probably been analyzing blood for centuries in the medical field, yet you're talking about analyzing it, not only looking for a disease, I mean, basically after a disease already happens, but really able to prevent disease from coming down the line. Like you said, it's a much more in-depth test, if you will.
Absolutely. So doing that, but then also some of these patients come in and they're presenting with already having autoimmune diseases, or they're already being managed for certain things by their primary care, which is fine. They can still also get alternative medicine management that is going to be more collaborative and integrative, which is very, very powerful, and then they tend to get better results.
Let me ask you this. When folks come in, how important is a consultation on the front end? I mean, because quite honestly, you have quite a toolbox of things that you can provide for folks. How important is that consultation to find out where they are exactly and what the best protocol is for them?
Well, that's where we tend to get that. We try to get their blood work ahead of time. We have them fill out a symptom survey ahead of time so we can kind of make a plan for what's going on. And then during the interview, we get to get even more in depth with what's going on. So we can kind of get them started, and then it's almost like a lab experiment. You're like, how is this patient responding to the treatment that we're giving them? And every so often we check, well, every week or two, we check back in with them, see how their symptoms are improving or not improving, and change the treatment plan from there.
Do you feel when you see a lot of different patients, you pretty much are able to take care of toddlers all the way up to the elderly? Do you seem that as we get older, we seem to settle? We seem to settle to feel okay instead of really being optimal with our health.
Absolutely. I think that people get used to not feeling so good, and so their new level of normal kind of declines, and then it declines some more, and then their baseline is just so much lower than it used to be.
Interesting. Viewers, take a look at the bottom of the screen right there. What you're going to see is their contact information. Keep in mind, we're talking about an office right here in Longmont that takes care of pretty much all of northern Denver right up here. We're talking about folks that come here are able to get treated in a way that probably you've never been treated before by using that of a very in-depth blood work and also chiropractic care taken care of here. They also have a Denver location that they're able to travel to and take care of folks back there as well. Take a look online, check out the reviews and testimonials, sign up for their newsletter, because basically one thing they love doing is basically educating people on what they have learned through their own pretty much personal journey as well. You've gone on through advanced training. One of those is applied kinesiology. Explain that to me.
Yeah. So basically what we're doing is we're testing each individual muscle, and we're figuring out how to activate it. So you have multiple muscles in your shoulder girdle. So we want to make sure that all those muscles are actually firing correctly. And then what we do is we figure out why that muscle isn't firing correctly. Is it too tight, and that's what's turned it off? And are other muscles compensating? So how do we activate that muscle? Do we need to do dry needling in order to stimulate that muscle? Do we need to do scar tissue? Do we need to adjust in that area? How do we activate it so that all the muscles in the shoulder girdle are firing correctly and also at the same strength?
What amazes me and actually frustrates me is that we here in the West, we're kind of behind the times. I mean, the Eastern philosophy, Eastern therapies that the Chinese have done for centuries, we're kind of starting to understand now. Is that what you find as well?
Yeah, I mean, a lot of the community has definitely started to embrace like the alternative care, and it really helps. It's non-invasive. It's trying to get the body to heal using its own immune system, as opposed to just throwing, well, I don't want to say it that way because you do need drugs at certain times, but as opposed to throwing drugs at your body to kill off other things.
Wonderful. I mean, are people kind of excited to find out that they can actually help their body by just taking a few simple steps, even by that of possibly taking supplements or herbs? And is that something you provide for here as well?
People are really impressed that when you can do all the spinal manipulation, spinal work, doing all the Graston therapy, and then also in combination, also doing the herbs, fixing their liver, knowing why they're hangry between meals, knowing why they're shaky, knowing why they can't lose weight, understanding what's going on, and then systemically treating that, trying to treat top down, like find the biggest system that needs help, and then fixing that, and a lot of the other systems will fall into place. So for example, like a woman's reproductive system is the first system to go when she is unhealthy or if there's another body system that's struggling or needs more help. And the reason is because the female reproductive system isn't needed to sustain our lives, right? So so for example, the blood sugar, would get priority at that point. So when you start to fix the blood sugar and the thyroid and you look at all these other systems, then what happens is that a lot of times will fix itself.
Body's an amazing thing if you just let it do what it's supposed to do. I mean, it's really kind of easy to neglect our bodies. Like I said early on, why do we need it today more than ever before? I mean, quite honestly, I believe they said up to 85,000 chemicals that we come in contact with over 7 days. I mean, I can understand why we now need detox, not only exercise, but maybe corrective exercise to really be a defense against this. This is what really people are finding here.
Right, and exactly to your point. The liver, you're exposed to 85,000 chemicals every 7 days. A lot of these haven't been researched, so we don't really know what they're doing in our body. Are these endocrine disruptors? Are these increasing, for example, a woman's estrogen and lowering their progesterone and giving her the inability to get pregnant, for example, or maintain pregnancy? So a lot of times just filtering out the liver, I mean, detox is such a buzzword, but a lot of times you see elevated liver enzymes. A lot of people on their Friday night, they're going on benders. You've got to really flush out the liver, right? So doing liver support is always really important, but again, we can tell how much liver support, or if someone actually does need liver support, by their blood work and what their liver enzymes look like. But it can make a huge difference. In allergy season, you can feel so much better, so much more energized. Your digestion can change. It's incredible if that's what you need, right?
Absolutely. You yourself, you've been exposed to chiropractic all your life. Like you said, it runs in the family. Is this something you're still very passionate about?
Oh, absolutely. I think I kind of underestimated how awesome it was or how great it was until I went to school, and I no longer had that. My dad was there all the time. He'd adjust me whenever I had something wrong. If I sprained an ankle, he was there. He was like my go-to person as a doctor. And then I moved away to go to college, and it was like, oh my God, like things are just not working the way that they used to. What do I do? That's when I started to really get a profound appreciation for what they do, or what we do too.
Makes for some interesting Thanksgiving conversations, I would imagine, as well. For yourself, you went through a transformation. Like you said, it changed your life. When you're able to see that firsthand with people in your own office now, is that rewarding?
Yeah, it's very humbling. When you see somebody, they come in and maybe their number one goal is to get out of pain. That tends to be the first thing they really want. Oh, just get me out of pain. Oh, just get me where I don't have to wake up 5 times and go to the bathroom in the middle of the night because I have such bad indigestion. Just get me to where I can actually make it through the day without taking a nap. Like, I just want to enjoy my kids. But then when you start to see them, you get them out of pain. And then suddenly they're like, well, I want to feel better than this. I think I can. Or I think I can actually, now I feel like I'm going to start this company, or I'm going to do this. Or suddenly their marriage is better. It's amazing. I've had patients come in where their marriage was in the toilet. They wanted to lose weight. They felt fatigued all the time. They felt lazy, and it completely will change their personality. It's incredible. And suddenly they feel energized and they love their life and they're excited. That's, it's humbling. You work hard, but you really want to wake up every day and do this because of that and those results, changing lives.
Just sitting here listening to you, it feels like my body is crying out for an adjustment. Absolutely. Viewers, take a look at the bottom of the screen right there. What you're going to basically see is their contact information. Basically, give them a call, set up an appointment, set up a consultation. If you've never been to a chiropractic office before, come on in. They'll walk you through the steps, explain to you the different processes they have here, many different protocols under one roof. And basically, this is it's a place that's easy accessible, not only here in Longmont, but also into the Denver area. Check out the reviews, testimonials online, and as well as their Facebook page. Once again, that is the Alternative Family Medicine and Chiropractic. This is Gary Atencio with CNTV. And if you don't know, now you know.